Yes, go ahead.
So good evening, everyone, and a very happy Krishna Janakpuri. This is especially for Rick. He should be knowing, he must not be knowing what is Krishna Janmashtami. So this is the day when our Lord Krishna was born, and to celebrate his birth, this auspicious day is celebrated all over India. So today's speaker we know is not very new for anyone. And it's my honor and privilege to welcome him for today's session, Dr. Deepak Sharma. He is a great homeopathic doctor, and many of you, or in fact everyone, would be knowing a lot about him. So I'll just tell a little bit short about him before he starts his lecture, and he mesmerizes you with his cases, what he has treated very successfully, and what is his approach, what is his way, which has been quite successful in treating many difficult cases, which were like all frustrated after taking many modes of medication. So he is our founder and director of Orbit Clinic, as well as Orbit Institute of Applied Homeopathy. And Orbit Clinic, as we know about, it's a very fast growing chain of homeopathy clinic, not only in India, but all over across the globe. He is a qualified government medical practitioner. He is running this Orbit Clinic in and around Delhi and NCR, and in many other parts like in Bangalore. He did his homeopathy in 2004 from a very reputed college called as National Homeopathic Medical College and Hospital, which is placed in Lucknow, which is the capital city of Uttar Pradesh. And this college is known to be one of the oldest colleges all over Asia. He not only has an inclination towards practicing homeopathy, but also he's a great learner and a great preacher. He has taken lots and lots of lectures, and he has been an international speaker on various channels. He is a general secretary of one temple, Mata Annapurna Mandir Samiti, which has been a registered Samiti. He is the executive director of HWC, that is Homeopathy World Council. He is the ex-general secretary of DHMA. He is the member of South Delhi Homeopathic Medical Association and a life member of many associations like Liga Medicorium Homeopathic Internationalists, Indian Institute of Homeopathic Physicians. He has been a co-host in Health In Show running on HWC, a live online video platform. So in short, I would like to say that he is a reputed and a very known lecturer and a doctor. So I would like him to present all his cases, his approach in the PCOS, and I hope everyone would like it. So Dr. Deepak Sharma, over to you.
Thank you, Dr. Shilpi. Thank you for this wonderful introduction. But still, I am a student of homeopathy. This is the simple and shortest interview for me. So I am sharing my PowerPoint. Hope all will enjoy it. So here is my first question. I give you all a question. Does anyone get the meaning of that symbol? This is very common and the first step of our homeopathic literature from the organelle. What I think that we are making it very easy presentation, and we are telling something about new things you did not know even after a long time of homeopathic field. So please share your views this will be a interactive session.
Basically, I think this is a symbol of some musical note, but what's the application of this in the aphorism, that I don't.
Yes, Dr. Shilpi, you are good. And this symbol represents the two things. Number one, this is a connecting link in between one aphorism to another aphorism. And the second meaning is that this is a musical note. This is a symbol of choosing from a musical note. Dr. Henneman was such a nice person, and he chose only this symbol. So what does it mean? That in the entire organon, you just not follow the aphorism one, then two, then three, then four, then five. You just make a interconnection of the aphorism. Like a patient is coming with a headache, then you took the aphorism three first, and then the seven, then the 84. So it doesn't mean that you are making the organ from first to 293. You're just making your own song by this musical note. So this is the actual meaning of this symbol, and I presented many time, and in every conference, only less than 1% know about the meaning of this symbol. So this is we should know about the simple things from our organon which Dr. Henneman wrote and in this very simple language. So this is I am starting from my question, and now what I'm showing that at Orbit Clinics we got 246 cases of PCOS during March 2011 to March 2017. This is a case study of Orbit Clinics on PCOS. We are doing it in a very huge manner. In this time, we have 7 branches, and today we have the 10 branches all over the world. So this data is collected from the 7 branches of Orbit Clinics, and the data is of 246 cases, in which 164 cases were treated very successfully. 58 cases was still running at that time, and 08 cases can untreated include unsatisfaction, have impatience, hurry to treatment, not supportive to the treatment. 6 cases I cannot treat or refer to another homeopath. That is my always opinion. I am not referring any case to second pathy. I am not referring to the allopath. I am not referring to the Ayurvedic physician. I always refer my cases. If I cannot treat, I refer to my seniors who is a homeopathy. So this is our policy. So this is a graphical representation of that study. Now, the treatment plan. In each case of PCOS, we have 4 approaches. Number one, the medicinal treatment. Number two, the diet plan. Number three is the exercise. And number four is the counseling. These 4 steps are very necessary to treat your PCOS case. If you are not following all of these steps, even you are not curing your PCS with the 2 steps only. You need to understand the actual diet plan. You need to understand the how you advise the exercise, how you do the counseling. That is the most common part of that you will learn from Dr. Shakshi and on Monday. But these 4 plans we got in this study. Now, you know about the causes of PCOS. You learned from Dr. Manisha Yadav. You learned from Dr. Shilpi Arora about the physiology and a little causes. And but there are a few hidden causes, because many of the study shows that PCOS is caused by the insulin resistance or the high level of testosterone. But how? But why the testosterone is increasing, or the why the insulin resistance is coming? So in India, there are many causes, but there are hidden causes that are not written in any book. And I am surprised that researchers are not doing on these hidden causes. The monosodium glutamate potassium bromate, and the main is sodium benzoate. You are eating in your preservative food. This is the main cause of insulin resistance and the diseases like migraine or the PCOS or the hypothyroidism. These salts are very common in the chips you are eating, kurkure you are eating, burgers you are eating, and pizzas you are eating, and in many things, many things. This salt is very dangerous. So this is the main cause we are getting in my study, that these three salts are very harmful to everyone, either for the female, either for the male. Second, we are getting the stress related to ignorance. If the stress related to ignorance, meaning she is ignored by her parents, she is ignored by her friend, she is ignored by her boyfriend, she is ignored by her husband. So stress related to ignorance is the main cause of PCOS. We are trying to teach every disease, and in Harrison or any practice of medicine wrote that every disease is caused by the stress. But which type of stress causing the PCOS, you should know about this. So stress related to ignorance is the main cause of diseases like the PCOS or the hypothyroidism. Now, the next cause is the irregular use of OCPs. In India, many of the female are using irregular use of OCPs. Like today, we have a Janmashtami, and any of the female is approaching to the menstrual cycle for this festive season, but by the fear or by the not having very much knowledge, she is taking OCPs from the general store or from any doctor to avoid her menses during the festive season or during the tourism or during whatever the causes may be. So irregular use of OCPs, the oral contraceptive pills, is the one of the major cause of the PCOS. Next one is the male pattern thinking. In Asian countries, everyone knows that the female was very reserved in the past and showing no dominancy, but nowadays, the female is coming with her dominancy, and she showed that the male pattern thinking. I will ride the bike, I will show my uh, power, and comparing with the males, that is also we are getting in this study. So male pattern thinking is have a broad topic, and that is starting from the beginning of the conceiving. If you are thinking that a mother is conceiving, then a female cannot be born. It is a choice of a female. Means कि अगर एक माँ अगर ये सोचने लगे कि बस एक फीमेल ना हो जाए, कोई मुझे लड़का चाहिए, तो यहीं से एक शुरुआत होती है मेल पैटर्न थिंकिंग की। यहाँ से हमें यहीं से एक फीमेल की शुरुआत हो जाती है। जब कभी फीमेल हो जाती है तो हमने ये स्ट्रेस भी देखे होंगे कि फीमेल हो गई, अरे अब क्या होगा। ऐसी बहुत सारी स्ट्रेस है जो पीसीओएस जैसी बीमारियों को लेकर के आती है। So male pattern thinking is the biggest cause in, especially in the developing countries and in Asian countries especially. By these cause, I always remind every female that your uterus or the ovaries are always crying, and they need a help from you. And I always advise to every female, help your genitals. Do not give a stress to them. If you are giving stress, then your genitals will be hurt, definitely. So there is this is my first case. This is a case of 21-year female presenting with the complaints of irregular menses for 2 years, and in last 2 years she is only having periods with only HRT, the hormone replacement therapy. Menses were scanty, clotted, and painful even after taking the HRT. Dysmenorrhea was so intense that she had to take some analgesic. Menstrual bleeding was presented for only 1 or 1.5 days. This is very important thing. I will tell you about the 1 and 1.5 days. This is also written in our repertoire. In this case, every doctor diagnosed as a PCOS and told there is no treatment except HRT. She was very fed up. Family history was not significant, past history was not significant, but you should remember that you cannot cure the patient in a single step. You cannot cure the patient in a single visit. You cannot get the proper history in a single visit. You should take a time. And many times, a female coming with the diagnosis of PCOS, coming with their mother or with their parents or with their friends, cannot tell you each and everything on your first visit. In this case, we need to understand her actual situation in a 3 to 4 months. We need a time. On every visit, she is coming with her mother, she is coming with her brother or father, but cannot we cannot take a case alone without any attendant. So once in a day, and after 3 months, she is come alone, and then we starting to take a actual case. And what we found, these are the common things. The physical general, her physical appetite was reduced, her thirst was increased, thermals was hot, desire for chocolates plus 3, and desire for milk 1 plus, sleep disturbed and lie on abdomen 1 plus, artistic ability on in the mental journals we found, dancing love for, organized things much, sympathetic to suffering to others, and suicidal thoughts. These are mental journals we found. But in the third or fourth month, what we are actually getting, that she is hurting by many things. What we are getting in this case, she was pursuing the serious preparation. Serious is like a army person or a navy person. As her father wished so that she should be a CDS or the army person in the future. Her passion was to do charitable public work solely serving to humans. She was fond of paintings. She was fond of arts, and she loved to dancing. But the main thing is we found the history of molestation in her childhood, and the molestation was the very bad. And after that, she is feeling very alone. She cannot say these type of things to anyone, even cannot share to her husband. Oh, sorry, cannot share to her friends or the mother. But this she is actually molested badly by a tuition teacher, and the molestation was not like the rape, but she was only molested by the inappropriate touch to her. And this is the biggest thing we are getting in this case. We are also getting about the ignorance from her father. She shared one time with her colleague about this molestation, but she also ignored her, and nobody helped her in this case. After that, she did not talk this topic to anyone, and she is feeling very alone. She tried to suicide but failed, felt like in giving up as she was not able to vent it out. So think that by inappropriate touch, she is getting the irregular menses. So this is the actual hurting of the femininity of a female. You should consider this step and think about the entire process, the entire pathology, since when the pathology is converting from physiology to pathology. So this is the we are getting after 3 months of the cases. So in every cases, you cannot get history on the single step. So take a proper case, take a history from the attendant, take a history from the patient in a single step, and take a emotionally history. That is the main thing in each and every case, especially in the PCOS. She also felt like the mother treats her like a stepchild. She's thinking, but her mother is not thinking like that. But she felt that mother treats her like a stepchild. So many things we are considering as a symptom cannot be confirmed by the attendant. So many symptoms you should confirm by the attendant is also a feature of a physician. So that's why I am always saying, and you also wrote that case taking is not a science. Case taking is an art only. How do you take the case? How do you reach the people? How do you reach people emotionally or from inside? So this is the life space of her, and after that, what we get the totality of symptom is love for painting and dancing, fastidiousness, too much parental control, ambition, recessive tendency to suicide, sympathetic nature, feels lonely, hearted to others, to those love most, sleeps on abdomen. And after these symptoms, what we are getting this reporting chart, and in which the first medicine is come up with pulsatilla, lycopodium, netramure, arsenic, carcinosin, Naxomita, Platina, Legacy. But reported does not always show the first medicine is not confirming. We are confirming it by the other symptoms, and we choose the carcinosin as the prime medicine for her for the history of molestation. As Dr. Fogister says, this is the only single medicine if you have a history of molestation in the past, and many complaints are after that. This is the only medicine. So we choose to give the medicine carcinosin. Now remedy is carcinosin, but I boldline it. This come not in a single day. The carcinosin 200 was given as a water dose. Now, do you know about water doses? Can anyone explain about water doses so that I will clear that what is actually the water dose? Please write if you, anyone know, or switch on your mic. Pellets in water, good. Water dose, medicine dispense in water. But how much dose you take and how many pellets you take in water? 1 drop of carcinosin in 30 ml of water. 10 pellets in 60 ml of water. Good. Good. Any other one to share about the water doses? Okay. Now I am explaining what is actually the water dosing. Except you are nearly approaching the water dosage, but the water dosage means the 100 ml of water which are mixed with the 8 to 10 drop of plain alcohol, or whatsoever we are calling the SL, the circumlactic, and the one drop means the 0.05 ml of the dilution into the 100 ml of water, and mix it very well and take a sip by sip every hourly or every 2 hourly or every 3 hourly. That will depend on the strength of the patient and the strength of the symptom. So in this case, what we are suggesting that you should take the 100 ml of the water, and we are mixing the 1 drop of carcinosin 200 in 100 ml water, and we are giving it for 2 days at the interval of 3 hourly. But remember, if you are getting any kind of symptom in between the doses, like you start at 12 p.m. with the carcinosin 200 in the water dose. And in the evening 6 o'clock, a series is coming, or patient is feeling very happy, or the patient is feeling the loose motion, getting the loose motion, patient is feeling mild feverish, patient is feeling anything positive, then stop the medicine at that time and do not repeat it again. So you should explain the patient, if you are getting any symptoms in between, then just inform us. Then we tell the medicine should be continued or not. This is actually the water dose we are giving here. And after carcinosin, we are repeating the Rubramed 30 twice in a day for 1 month on 11th May of 2019. Now here I am presenting the new cases. I am not presenting the cases from that history we are having from case, but this is a new case we are having with a single medicines, uh, getting the regular menstrual cycle. And after carcinosin and Rubramed, her LMP was 6th May 2019, then 16 June 1924, July, then on 29th of August, 30th of September, 26th of October, 28th of November, 21 of December, and 24th of January 2020. Still, she is having normal period. So this is actually the magic of homeopathy. If we are getting the exact remedy, then it will work very quickly. So you should not wait for this. So this is actually we are living in the case, but I am explaining we are getting the symptoms after 3 months. We are not getting the symptom in a 1 month. So in starting of 3 months, we are giving Harletamure, Ignitia, which are not working. But after taking the proper history, the carcinosin in a single dose is worked well. So these the remedy with a good case taking and the perfect case taking.
Dr. Deepak, Rick has said that could you please write down how to prepare the water dose and how it's used? If you can just allow me to do the annotation, I'll write it down on the screen. You just say.
Yes, please.
Yeah, just allow me to have the annotation. I'll write it while you say. I'll write it down on the screen.
Yes, allow.
Fine. So what is the water dosage? I'm still unable
You are
to write.
taking the
Yeah, tell me.
just take 1 drop of medicine
1 drop of medicine
in 100 ml of water
in 100 ml of water
and 8 to 10 drop of pure alcohol, which is so-called SL. This SL we are adding only to save the water.
Okay. Then how is the repetition done?
That depends on the case. In this case, we repeated it every 3 hours.
Okay, 3 hourly. And how much was the dosage? How much she has to drink at a time?
About 3 to 5 ml, one small spoon.
About 3 to 5 ml.
And one more thing, as I am suggesting Dr. Diksha, because in many countries there is no ability of the liquid dilution. So take a 3 to 4 pills of 10 number, or the one pill of 40 number pill.
Hmm.
3 to 4 pills of 10 number pills.
Okay, 10 number.
Okay.
And now Rick is asking, is there any equivalent that you use if you have only pallets? If only pallets, only pills are there, then how do you use it?
If we are having only pills, then I
Hmm.
told that 3 to 4 pills of 10 number globule and only one pill of 40 number globule.
Okay, one pill of 40 number, 3 to 4 pill of 10 number.
Got it? So what was the conclusion? The main choice of medicine was dependent on the strong history of prolonged childhood use, and we missed for about 3 months. Hence, we started with nosode as indicated in this case. Nosode help us in opening the case. Always remember, many books are wrote that you cannot use the nosode in the first visit or the first prescription. But in my practice, I am not seeing anything like that. I am using the first prescription with the nose road, and this is very perfect. If you are getting the symptom, you just use your nose road or the sarcode or from the vegetable kingdom or from the animal kingdom in first prescription, but the symptoms or the history should be matched. So nosode help us in opening the case of symptoms which have been produced to a prolonged suppression. That is the main conclusion we are having. Now, here is the female. You should listen her, what she said.
And Dr. Deepak, I think voice is not clear.
What you said, what she did.
The voice was not clear. Means I was not able to hear. I don't know about others.
Okay. I will send the link of that female to everyone so that everyone can listen her. I cannot show her face due to the privacy issues.
Mhm.
Now, the next case. So, Diksha, Dr. Shilpi will explain you, but I should explain this case in Hindi language because this case is having much more essence. So, ये एक 16 ईयर की फीमेल हमारे पास आई अपनी मदर के साथ, और हमें जो परेशानी इसने बताई वो बताई कि इरेगुलर मेंसेस हैं इसको 1 साल से, कभी 2 महीने में आ रहे हैं, कभी 3 महीने में आ रहे हैं। एक इसकी सबसे बड़ी प्रॉब्लम थी कि इसको सेंसेशन ऐसे होते थे कि इसको मेंस्ट्रुअल पेन हो रहे हैं पिछले 2-3 महीनों से, और ये जब भी हो रहे हैं जब उसको मेंसेस का टाइम आना होता है। जैसे किसी भी हर एक फीमेल की वैसे बहुत कॉमन सिम्टम है कि अगर उसको 1 महीने में 28 तारीख को सिम्टम आए, मेंसेस आए हैं, तो उसको नेक्स्ट मंथ की 28 तारीख को ऐसा फील होगा, चाहे मेंसेस आए या ना आए, कि उसको पेन हुआ है। ये एक पीरियडिकल साइकिल है, ये हार्मोन जनरली ऐसा होता है, बहुत कॉमन है। लेकिन इसको पिछले 2-3 महीने से ऐसा हो रहा था कि इसको सेंसेशन हो रही थी पेन की, लेकिन मेंस्ट्रुअल साइकिल जो है वो प्रॉपर नहीं आ रहे थे। ऐसा इसको 1 साल से ऐसा चल रहा था। पिछले 2-3 महीनों से इसको बहुत माइल्ड हेडेक्स भी थे। हमने जब हिस्ट्री ली तो पाया The menses was normal with 2 to 3 days of about normal bleeding with mild pains. मतलब ऐसी कोई menstrual में ऐसी स्टेज नहीं मिली जितने पिछले साइकिल थे कि उसको कोई बहुत ज़्यादा पेन रहते हों या बहुत ज़्यादा इरेगुलर साइकिल्स हो या बहुत ज़्यादा ब्लीडिंग होती हो या किसी टाइप का कोई डिस्चार्ज होता हो। और हमें ऐसी कोई मेडिकल सिग्निफिकेंट हिस्ट्री भी नहीं मिली, लेकिन एक हिस्ट्री जरूर मिली जहाँ पे इसने ओसीपीज का यूज़ किया था विदाउट एनी मेडिकल प्रिस्क्रिप्शन एज आई मेंशन इन द हिडन कॉजेज। सो द इरेगुलर यूज ऑफ ओसीपीज एक इतना बड़ा फैक्टर है, खासकर डेवलपिंग कंट्रीज में जहाँ पे मेडिकल प्रिस्क्रिप्शन के बिना मेडिकल सोर्स पे या बाकी किसी भी जगह पर दवाई मिल जाती है, ऑनलाइन दवाई परचेज कर लेते हैं। जो अच्छे डॉक्टर्स हैं वो इस चीज़ को हमेशा मना करते हैं कि कभी भी आपको साइकिल रोकने के लिए 4-5 दिन की मेडिसिन नहीं लेनी है, लेकिन हमारे यहाँ फीमेल्स को मंदिर जाना है, कहीं घूमना है, कोई त्योहार मनाना है, इसके लिए मैंने देखा है कि जो एजुकेटेड फीमेल्स हैं वो भी खुद मेडिसिन लेती हैं, अपनी बेटियों को या अपनी फ्रेंड्स को भी ये सजेस्ट करती हैं कि यार वहाँ से ये मेडिसिन मिल जाएगी, हम 4 दिन के लिए मेडिसिन लेंगे और ये साइकिल स्किप हो जाएगा और हमारा त्यौहार बन जाएगा। अगर त्यौहार भी नहीं है तो फिर टूरिज्म एक सबसे बड़ा फैक्टर है। हर फीमेल ये चाहती है कि मेरे को कहीं भी ऐसी ब्लीडिंग ना हो ताकि मेरा कोई त्यौहार या कोई भी टूर खराब ना हो। तो ये जो इरेगुलर यूज ऑफ ओसीपीज है इस समय का, वो सबसे मेन कंसेप्ट है पीसीओएस को डेवलप होने का। तो यहाँ पे इसने ओसीपीज को यूज किया था, लेकिन बहुत कई बार ऐसा नहीं हुआ, कुछ टाइम तक इसने काफी हद तक ओसीपी यूज किया है और इसकी मदर के नॉलेज के बिना। हमने कुछ और हिस्ट्री ली क्योंकि हम हर एक पीसीओएस केस को थोड़ा अलग से टाइम देते हैं और हम पता लगाने की कोशिश करते हैं कि आखिर पीसीओएस क्यों डेवलप हुआ। हमने इसके बारे में पता किया कि इसके जो ड्रीम्स थे वो बहुत थोड़े पर्टिकुलर थे, ड्रीमिंग ऑफ गेटिंग स्पॉल्ड बाय मल्टीपल पीपल, ये इसका सबसे मेन ड्रीम था। इसकी हमारे यहाँ बहुत ही अच्छी मेडिसिन है। Another dream that keep coming quite frequently are dreams of falling from height, especially from hills. History of sexual abuse of age of 12 years. Now हमें मैक्सिमम केसेस में जहाँ पे मैंने आपको इग्नोरेंस के बारे में बताया, तो ऐसी इग्नोरेंस भी जहाँ पे किसी भी फीमेल के साथ कुछ भी गलत हुआ है और उसके बाद उसको अनसुना कर दिया गया या उसके बारे में ये नहीं बताया गया कि आखिर तुम्हें क्या करना है, या किसी भी प्रकार से उसकी कोई हेल्प ना करे, या तो उसकी मदर हो या उसकी फ्रेंड हो या कोई भी या उसका भाई हो। अगर ऐसा होता है तो ये इग्नोरेंस भी पीसीओएस का अपना एक कॉज है। यहाँ पे किसी भी फीमेल की फैमिली बहुत ज़्यादा हर्ट होती है। ये सिर्फ डेवलपिंग कंट्री में, ये डेवलप्ड कंट्री में भी है और ये हर जगह एक ऐसी चीज़ है जो बहुत ज़्यादा मिलती है। हमें बस केसेस को पकड़ना होता है कि हमें देखना होता है कि आखिर क्या है। तो यहाँ पे भी ये सेक्सुअल अब्यूज की जो हिस्ट्री है ये बहुत प्रोमिनेंट थी। इस फीमेल की कुछ खास बात थी कि बहुत इंटेलेक्चुअल थी, बहुत अच्छा कुछ करना चाहती थी, कीन ऑब्जर्वर थी, बहुत स्मार्ट भी थी, बहुत ही सॉफ्ट स्पोकन थी। इतनी ज़्यादा कीन ऑब्जर्वर थी कि कभी कभी वो मेरे को मैं क्या पूछने वाला हूँ ये तक भी मुझे बता देती थी कि सर अब आप ऐसा कुछ पूछोगे। मैंने कहा ठीक है। एक खास बात ये थी कि इसकी किसी भी पैथोलॉजिकल रिपोर्ट्स में कोई भी फाइंडिंग नजर नहीं आई या कोई भी अबनॉर्मलिटी किसी भी तरीके की नहीं थी। ना, मैं चाहता हूँ कि जो भी मैं केस बताऊंगा या जिस भी रेमेडी के बारे में बताऊंगा, लेकिन उससे पहले एक बार इस फीमेल को सुनना जरूर।
Hello, my name is Deepak. I'm struggling with the periods. That's been for 2 years. Prior to lifestyle
This time voice is clear, Dr. Sharma?
For me, it's not very clear. I don't know about others.
Just a minute. I am repeating it again.
My name is Deepak Sharma. I've struggled with the regular periods for a few years before I found FIBROIDS. I found a treatment in the Consultation. That's been for 2 years. Prior to major lifestyle change along with medicines. I found it hard to relate the relevance of my past experiences, emotions, and dreams to my health condition. I after proceeding with some treatment, I realized how my experience
This time clear?
Hello, my name is Deepak Sharma. I'm struggling with
Shilpi, is the message clear?
No, voice is not clear. It's not audible. Majority of the people are saying the same.
So what she said कि जो भी इसको लगा होम्योपैथी में आकर के, तो जो भी मैंने इससे ड्रीम्स पूछे, जो भी मैंने इसके मेंटल सिम्टम्स लिए, वो इसके लिए शॉकिंग थे। और ये ऐसा लगा इसको कि ऐसा कैसे हो सकता है कि हमारे जो मेंटल सिम्टम्स हैं वो किसी भी टाइप की फिजिकल डिजीज के साथ इतने कनेक्ट हो सकते हैं कि उसके मेंस्ट्रुअल साइकिल जो है वो इरेगुलर हो जाए। तो ये जो फीमेल थी, ये हमारी अभी तक की सबसे बहुत परफेक्ट पेशेंट थी, जिसको हमने बहुत परफेक्टली ट्रीट किया। मैं भी आप सब लोगों से इसके बारे में कुछ जानकारी चाहूँगा कि अगर आपने इसके बारे में जो भी रेमेडी सोची होगी, वो प्लीज़ मुझे चैट में बताएं। जो भी मैंने हिस्ट्री बताई है, इसी हिस्ट्री के आधार पे आप कौन कौन सी इस समय मेडिसिन देना चाहते हैं, या कोई और आपने क्या सोचा, मतलब इसको क्या कैसे प्लान करना चाहेंगे, मुझे चैट में ज़रूर बताएं।
Okay, and Dr. Deepak, let me explain the whole thing in English again.
यस प्लीज़।
Please go back to the previous slide. Yeah. So this case, which Dr. Deepak has presented, is a case of a 16-year female. She came with her mother to consult with Dr. Deepak. And the major complaints which she presented was she was having irregular menstrual cycles since past 1 year. Before that, the cycles were quite not regular. But the major peculiar characteristic which is written over here is that whenever the date, the time of the menses was appearing, that time she was having the same kind of a sensation which she used to have during the regular cycle. But there was no appearance of menstrual flow. It was just a pain, a kind of a discomfort which she used to feel during the regular used to feel. And this was from past 2 or 3 cycles. Along with that, she was having mild headache, which also used to occur since past 2 to 3 months during the or before when the cycle was coming. The history when it was taken, the menses were normal. They used to come for 2 to 3 days, slight mild pain, which was not very severe. Apart from that, there was no significant medical history which could be collected. The only history which she presented was that in order to delay her menstrual cycle, she has taken the oral contraceptive pills without any kind of medical prescription. So this was too young age for her to take these OCPs with the periods, and her mother was not aware of that. So the mother also got to know while taking the case that she has taken OCPs not only once but multiple times. Next slide. Now, the another peculiar symptom which was taken was when she was asked about her sleep and dreams. It was found that she had few peculiar dreams which was very much pointing towards the guiding symptoms for the medicines. So the major thing which was noticed was that she used to dream of getting scolded by multiple people at a time. And this dream used to occur many a time. It was a recurring dream. Another dream that used to come very frequently was that she was falling from height, especially from the hills. And when asked more in depth, she told a little bit about that she had some history of sexual abuse at the age of 12 years. And when we had when Dr. Deepak observed about her, she was found to be quite intelligent. The way she was presenting herself, the way she was talking about seems to be very intellectual. And she was very keen observer patient. She was sometimes so keen observation that Dr. Deepak was thrilled, or you can say he was quite that why she was able to tell that what is the type of a question he will be asking. So too much of keen observer she was that she used to tell. She was quite smart looking and very soft spoken, not very rude or arrogant or anything. Then in the video, in the audio which was shown, that she was mainly telling about that she was quite, she was not having the proper words to explain that how can you, is my voice not audible? Is my voice clear?
Yes.
Yeah, fine. So she had mentioned that she was quite unaware, like how can you be relating the dreams, your past history to the present complaint she's having. She was so much thrilled that so deep knowledge and so deeply the history was taken. And then once the case was taken and the medicines were given, she was quite relieved with the symptoms. So now Dr. Deepak is asking, like, what could be the possible medicine that we can think of? So anyone having anything? I think some few people have sent. Dr. Abhishek Duggal, Mr. Abhishek Duggal has said that the medicine can be borax, dreams of falling.
Dr. Abhishek, Dr. Rick, you are.
Rick said sepia.
Yes. What I am telling that the dreaming of getting spoiled by multiple people, the medicine is Kali Nitika. Dream of falling from the height. Puja is a wonderful medicine. History of sexual abuse at 12 years, I already told the carcinosin is a wonderful remedy. But every time you should not think about the medicine. Think about the other things in every case. Like in this case, there is no medicine. What we are suggesting to everyone that why we are always thinking about the remedy in each symptom. Why? Many of the homeopaths are going somewhere and looking to a person and thinking like that, oh, this is a lycopodium, oh, this is a puja, or she is a sepia. No, never think like that. I told you about the 4 things in the PCOS case. Number 1, the medicinal treatment. Number 2 is the diet. Number 3 is the counseling and the management part and the exercises. So in this case, we only use the counseling and we are getting the best result with the Rubramate 30. In every visit, I explained her to avoid and to forget about the past. You just think about the exercise and think the positively. And yes, we got the result. In next 2 to 3 months, she's getting very perfect regular menstruation without any kind of remedy. So I am presenting this case in every conference that you should not thinking about the medicine always. Many things are working. Management is the best if you know. And in this case, we are not giving any kind of medicine. She is in Germany now. She is a German language and she is working very fine. Till date, she is having a normal periods. There is nothing. And she also forget about this the past history because इसकी जो सबसे
इसका रखा हुआ है क्यों?
सबसे बड़ी परेशानी थी वो सिर्फ एक ही चीज की थी कि उसने कभी भी इस बात को किसी को भी नहीं बताया, ना अपने भाई को, ना अपने फ्रेंड को, ना अपनी मदर को, ना किसी और को। ये फर्स्ट टाइम था जब ये केस मतलब जो ये हिस्ट्री है जो इसकी हमने निकाली, जो हमने इसके ड्रीम्स पूछे, ये पहली बार ऐसा शेयर हो रहे थे। तो हमने सोचा कि मैंने कहा हो सकता है कि यहाँ पर काउंसलिंग थोड़ा अच्छा काम करे, क्योंकि हमें बाकी किसी भी पैथोलॉजी ना हमें कोई रिपोर्ट्स में मिल रही है, ना हमें कोई इसकी फिजिकल पैथोलॉजी मिल रही है, ना हमें कोई ऐसे कोई एग्रेवेशन या एम्बुलेशन के सिम्टम मिल रहे हैं। तो हमने सबसे बेस्ट तरीका निकाला, इसको काउंसलिंग से ठीक करके देखते हैं और इट वर्क। यस बहुत सारे लोग कहते हैं कि कहीं ऐसा तो नहीं कि होम्योपैथी काम करती है और कहीं काम नहीं करती, तो जरूरी नहीं कि हर समय आपको सीपिया सोचनी है। यू आर नॉट ऑलवेज थिंकिंग अबाउट द सीपिया और लेक्टेन और द कालिका nitricum. Yes, we have the peculiar symptom of the kali nitricum. We have the peculiar symptom of puja. We have a peculiar history of carcinosis, but still we are not giving any medicine to this case. So this is the case where we are not using any kind of medicine. So now coming on the third case, a 25-year of married female came with an ultrasound with a huge cyst of about 10 centimeter in her ovary, was purely operative case by a pathologist. Actually, this case was referred by a pathologist to me, and she's actually, the presenting complaint was actually this, that she's repeating again and again, can you treat these type of cases, doctor? Multiple times she's asking asked about that question only. तो डॉक्टर आप सिर्फ ये केसेस ऐसे ठीक कर सकते हैं या नहीं? सिर्फ रिपोर्ट के आधार पे अभी ना वो मुझे सिम्टम बता रही है, not she is telling her history, not she is telling about the pain, not she is telling about the menstrual cycle. She is only query about that, can you treat these type of cases only? So this is her actually the presenting complaint. Then we start to take case and we explain the about the homeopathy first, and then she is convincing and tell us the symptom. And her physical journals was appetite low, menstruation was regular with cramps in thighs, especially initially, second or third days, almost fainted and need bed rest at the time of menstrual cramps. She is having white discharge per vagina occasionally, which is not quite pathological. Desire for chocolates and sweets. Her mental journals was fearful, especially for society and security of children. Dream of snakes, multiple black colors of the snakes, and the fear from the snakes. Can anyone give the clue of this symptom, the dream of snakes, and the kind of black snakes she's seen in her dreams, or fear from the dreams? And the next symptom is irritable all the time, especially on family members. For others, she is so quiet and simple. जो लोग भी ड्रीम ऑफ स्नेक पे कभी मुझसे पढ़ना चाहेंगे तो मैं उन लोगों को बताऊंगा कि जो ड्रीम ऑफ स्नेक है ये भी अपने आप में एक बड़ा टॉपिक है, और हमारी एक स्टडी ड्रीम ऑफ स्नेक पे भी रही है। कभी मौका मिलेगा तो आप सब लोगों को एक बार फिर से पढ़ाऊंगा। ड्रीम ऑफ स्नेक में भी हमारे पास बहुत सारी रेमेडीज है। मैं चाहता हूँ कि जो ये सिम्टम मैंने बताया कि ड्रीम ऑफ स्नेक्स हैं, उसमें बहुत सारे काले सांप दिखते हैं और उसको फियर भी है सांपों का, इसकी क्या पॉसिबल मेडिसिन हो सकती है वो जरा एक बार चैट में बताए अगर किसी को मालूम है या कोई सोच पा रहा है तो। अगर आपको हरे रंग के सांप दिखते हैं तो उसकी अलग रेमेडी है, अगर आपको पीले रंग के सांप दिखते हैं तो वो उसकी एक अलग रेमेडी है, अगर आपको सांप काटते हैं तो अलग रेमेडी है, और अगर आप सांप को काटते हैं तो उसकी अलग रेमेडी है। दैट इज द मैजिक ऑफ होम्योपैथी, जो आपके सबकॉन्शियस माइंड को भी ठीक कर सकती है। तो अगर आप कोई होम्योपैथिक मेडिसिन या कोई भी पूरी दुनिया में और किसी भी पैथी में इतनी ताकत नहीं है कि वो आपके सबकॉन्शियस माइंड को हर्ट कर सके। आपको सुला तो सकते हैं एनालिसिस दे करके, आपको स्लीपिंग पिल्स दे करके सुला तो सकते हैं अच्छे से, लेकिन आपके ड्रीम्स को ठीक करने की ताकत सिर्फ और सिर्फ होम्योपैथी में है। तो अगर इस सिम्टम पे, ड्रीम ऑफ स्नेक वाले सिम्टम पे किसी को कोई मेडिसिन आ रही है तो मुझे बताएं। लेकेसिस एंड वेस्पा, गुड। डॉक्टर आकांक्षा, वेरी गुड। और डॉक्टर आकांक्षा, क्या आपको मालूम है कि जो कैंट की पटरी है उसमें ड्रीम ऑफ स्नेक्स में लेकेसिस कहीं भी नहीं आती है? वाइट कैंट। और गुड, ठीक है, बहुत अच्छी है। इसमें बोस्टा भी आती है, कालीन नाइट्रिकम अपने आप में एक बढ़िया मेडिसिन है। जब भी कभी ड्रीम्स आपको डिस्टर्ब मिले कहीं पे भी किसी भी टाइप के ऐसे ड्रीम्स जो बिल्कुल ही अलग है, तो आप जरा एक बार कालीन नाइट्रिकम को जरूर सोचना, वो एक बहुत बढ़िया मेडिसिन है। यहाँ केसेस में क्योंकि हमारे पास बहुत सारे सिम्टम है और मैं इसकी पैथोलॉजिकल रिपोर्ट पहले दिखा देता हूँ आपको। अगर आपको इसके केस के बारे में दिख रहा होगा तो जो फर्स्ट स्लाइड है उसमें ए वेल डिफाइंड लोबुलेटेड सिस्टिक लीजन विद इंटरनल माइल्ड थिक सेप्टेशन नोटेड इन लेफ्ट एडिनेक्सल एरिया appears to be arising from left ovary. No evidence of solid component areas seen. Ovaries are not delineated separately. Size of lesion approximately 10 by 9 by 8 centimeter. This pathologist are my friend, and he is only suggesting that you can do the surgery only. But if you want to avoid the surgery, you just go to my friend Dr. Deepak Sharma, and he is referring to me. And and the case was on August 2015. I again सेंड, मतलब जब भी आपके पास कोई ऐसे रिपोर्ट्स आए तो आप हमेशा ये कोशिश करना है कि आपको जो भी रिपोर्ट की रीएनालिसिस करनी है आप सेम पैथोलॉजिस्ट या सेम लेबोरेटरी से भेजो, ताकि उस पैथोलॉजिस्ट को भी ये समझ में आए कि हमने जो अल्ट्रासाउंड किया था वो क्या था। और आप देख रहे हैं कि जो दूसरा अल्ट्रासाउंड है वो उसमें लगभग लगभग नॉर्मल स्टडी है, 10 महीने का ही लगभग लगभग ट्रीटमेंट था। और इसके बाद इस पैथोलॉजिस्ट ने हमारे पास जितने भी ऐसे सिस्ट के केस हैं सबसे पहले हमारे पास भेजते हैं। हम कहते हैं कि ऑपरेशन कराना है तो ये ऑपरेशन की तरफ मूव करते हैं, वरना ज्यादातर सिस्ट जो है वैसी ठीक हो जाती हैं। तो ये एक ऐसा केस था जो हमारे पास पैथोलॉजिस्ट ने भेजा, तो हमने भी पैथोलॉजिस्ट को ये करके दिखाया दैट इज एक्चुअली द होम्योपैथी नीड्स के आज की डेट में जो हमें चाहिए कि साइंस कनेक्ट हो होम्योपैथी के साथ, तो हमें ऐसा जरूर करना चाहिए। सो हमने ये सिम्टम कंसिडर किया, प्रिस्क्रिप्शन वाज लेकेसिस, सब के लिए ठीक था कि आपने लेकेसिस म्यूटस दी। हमने इसमें सिर्फ ड्रीम ऑफ स्नेक कंसिडर नहीं किया, हमने लेफ्ट साइड को भी कंसिडर किया और भी बहुत सारे सिम्टम थे जिसमें हमने लेकेसिस को चूज करा। और हमने लेकेसिस 1 and B सेम जो थ्योरी है वो वाटर डोजेज में फॉलोड बाय बेलेडोना 6C। नाउ यहाँ पे पैथोलॉजी आपको सिखाती है कि आपको आगे कैसे प्रोसीड करना है, यहाँ पे आपको फिजियोलॉजी बताती है कि आपको कैसे प्रोसीड करना है केस में। अब अगर आपको लेकिसिस म्यूटस के बारे में मालूम है और आपको ये मालूम है कि जो लेफ्ट ओवेरियन से जो कि अभी आपने देखा है, जो भी अभी आपने देखा था वो देखा था कि किसी भी टाइप का एक जो सिस्ट बनना था, मतलब जो भी हमारे पास एक हेमरेजिक सिस्ट थी वो लेफ्ट साइड में बहुत ही कॉम्प्लेक्स सिस्ट थी जिसका एक पर्टिकुलर साइज था। अब अगर मान लो आपने कोई मेडिसिन दी तो इस सिस्ट का होगा क्या, मतलब आपको पैथोलॉजी का जो फेट है वो जरूर जानना चाहिए कि अगर आपने कोई मेडिसिन दी और उसने कोई फंक्शन किया तो इसके दो कंडीशंस हो सकते हैं। या तो ओवरी में सब कुछ ऐसा का ऐसे ही डिजोल्व हो जाए और वो ब्लड स्ट्रीम के थ्रू अपने आप डिजोल्व होकर के सारे पॉइजन्स बाहर निकल जाए, या फिर ये कहीं रप्चर हो जाए और सब कुछ पेरिटोनियम में ड्रेन आउट हो जाए, जो कि थोड़ा खतरनाक है। तो हमारे पास पेशेंट को जब हमने लेकेसिस दी तो उसके 24 आवर बाद ही उसको थोड़ा डिस्चार्जेस हुए और उसको बहुत सीवियर पेन हुआ। डिस्चार्जेस का मतलब है कि जो पर वेजाइना डिस्चार्जेस हुए तो ये एक थोड़ा ऐसा सिम्टम था जो एक नॉर्मल वे में डिस्चार्जेस को बाहर निकाला था। उस पेन के लिए हमने बेलेडोना को चूज किया और उसको फॉलो अप किया सिर्फ रोग्रामेट से, और 10 महीने बाद जो भी अभी आपने रिपोर्ट देखी वो आपके सामने है। तो हमें ये भी जानना जरूरी है कि अगर किसी वजह से वो सिट्स जो है वो रप्चर कर गई तो क्या सिम्टम आएंगे और उसकी मेडिसिन क्या होंगी और आपको सर्जरी में रेफर करना है या नहीं। तो पैथोलॉजी हमें ये सिखाती है कि आखिर हमें केस को किस तरफ मूव करना है और कहाँ हमें केस को ले जाना है, ये बहुत जरूरी एक सिम्टम है। तो ये इस केस से जब हमें नॉलेज मिली, मैं इसको भी एक बार चलाने की कोशिश करता हूँ और माइक थोड़ा पास करता हूँ ताकि आप लोगों को इसके बारे में जरूर पता लगे। दक्षिल्पी इसका जो पॉइंटर है वो कैसे ऑफ होता है?
Pointer. Laser pointer. You go on that laser point.
हेलो, मेरा नाम दक्ति शर्मा है। मुझे
वॉइस क्लियर है अभी दक्षिल्पी?
नहीं,
आई विल सेपरेट सेंड सेपरेटली डॉक्टर के। और ये मैंने सब टेस्ट किए थे, लेकिन अभी माइक थोड़ा कम काम करने लगा। तो दिस इज माय थर्ड केस। और यहाँ पे हमें मुझे लगता है कि हर एक को ये जरूर सीखना चाहिए कि जो पीसीओडी का डेवलपमेंट है, जो ओवेरियन सिस्ट डेवलप कर रही है, ये जो भी उसमें पैथोलॉजी आ रही है, वो एक्चुअली आ कहाँ से रही है। हर एक पेशेंट को समझना, चाहे वो फिजिकली हो, चाहे वो मेंटल स्टेट के तौर पर हो, चाहे उसका फिजिकल एग्जामिनेशन हो, चाहे उसका क्लिनिकल एग्जामिनेशन हो, आपको सब कुछ करना है। बीइंग ए डॉक्टर बिहेव करना है, और बीइंग ए डॉक्टर आपको हमेशा हिस्ट्री लेनी है। सो ये मेरे पास अभी कुछ केसेस हैं, और आई थिंक डॉक्टर शिल्पी अभी टाइम भी हो गया, हालांकि और भी केसेस हैं, वो हम मंडे को प्रेजेंट कर लेंगे। अगर टाइम परमिट है तो मैं अभी भी कर सकता हूँ।
आई थिंक मंडे को करेंगे, बिकॉज अभी हमारे पास few questions हैं. I think we'll take up that. Dr. Abhishek is asking that can you elaborate that how the cyst rupture happened and what kind of a discharge went off in the case number 3 which you mentioned.
अभिषेक, मैंने आपको बताया कि जैसे जो डिस्चार्जेस पर वजाइना थे, ये एक नॉर्मल डिस्चार्जेस थे। मतलब अगर किसी भी ऐसे केसेस में जहाँ पे आपको हेमरेजिक सिस्ट या किसी भी टाइप के ऐसे सिस्ट को ड्रेन करना है, तो उस ड्रेन करने के अपने एक रास्ते होते हैं। अगर आपको फिजियोलॉजिकल ये मेथड्स मालूम है कि वो जो ड्रेन होगा वो कहाँ से होगा, जैसे हमारे पास बहुत सारे केस आते हैं जो स्किन के को लेकर के आते हैं, और सप्रेस डायरिया के आते हैं, तो वहाँ पे लूज मोशन लगते हैं, वहाँ पे यूरिन की फ्रीक्वेंसी थोड़ी ज़्यादा हो जाती है। हमारे पास जो डायबिटीज के केस होते हैं, वहाँ पे स्वेटिंग थोड़ा ज़्यादा बढ़ जाती है। तो आपको फिजियोलॉजिकली मालूम होना चाहिए कि कौन से केस की जो ड्रेनेज है वो कहाँ जाएगी। तो जनरली पीसीओएस के केसेस में जो ड्रेनेज है वो हमेशा पर वेजाइनल डिस्चार्ज से ही जाती है। अगर आपके पीसीओएस के केसेस या फाइब्रॉइड के केसेस ठीक होने होंगे, तो आपकी जो मेंस्ट्रुअल साइकिल है या आपके जो वेजाइनल डिस्चार्ज है वो कुछ समय के लिए बढ़ जाएंगे, लेकिन उससे कोई पैथोलॉजी क्रिएट नहीं होगी। तो आपको ये भी ध्यान रखना है कि जो डिस्चार्जेस हैं वो फिजियोलॉजिकल आ रहे हैं या वो पैथोलॉजिकल को और ज़्यादा बढ़ा रहे हैं। तो ये हमारी एक जिम्मेदारी बन जाती है, हमें इसलिए पैथोलॉजी और फिजियोलॉजी की नॉलेज होनी जरूरी है। हम यहाँ पे जो भी ये कोर्स करा रहे हैं, इसीलिए हम एनाटॉमी से लेकर के फिजियोलॉजी, पैथोलॉजी, क्लिनिकल साइंस को कनेक्ट करते हुए चल रहे हैं, ताकि आपको सब कुछ ये समझ में आए कि हाँ, ये केसेस जो है वो कैसे ठीक हो रहे हैं।
Fine. So Dr. DeepakSharma, will you be going for case 4 or should we wind up?
It depend on the student.
Okay.
Well,
No, Rick is asking that can you summarize this in English? Yeah, basically I'll tell you what Dr. Deepak was trying to say is, in case number 3, he has shown some pathological reports which show that there is some cystic lesion on the left side. So whenever we give like here we have a well-defined lobulated cystic lesion with internal mild thick septations noted in the left adaxial area. So with this pathological report, which was done in August 2015, within a span of 10 months, we can see that the normal study appeared and there was no such kind of cystic lesion seen in the next 10 years scan. So basically, when we are giving the medicine, we should be prepared about, we should know if the cyst is there, and after giving any medicine which we choose, we definitely know that the cyst either will be absorbed or it will be having a rupture, and the discharge of the cyst and the cyst rupture will be happening most of the cases per vaginal. So when the discharge is happening per vaginal, we should know how to handle the case after that, because in this case, when lachesis was given, she underwent within 24 hours, she had the rupture and she was presenting a symptom of excess discharge per vaginal. So in that case, belladonna was given in order to control the symptoms of the pain and other things, and the other medicines were given just to control whatever symptoms would appear after the rupture. So those were short-acting medicines given along with lachesis later on based on whatever symptoms were presented. So we should know that whenever we are trying to hit some pathological state, there will be some kind of symptoms definitely seen, but we should be knowing that what is the difference between the pathological symptom and what is a physiological changes. So in this case, like the discharge was there, it was not at all the pathological, it was just a physiological discharge, which in our case was very, very obvious and should have happened. And that female is now healthy and having regular menstrual cycles, and she is free from these cystic lesions. The basis of choosing lachesis was on her dreams as well as on me being left-sided. Yep.
Thank you, Dr. Shetty. Thank you so much. And one more question is there from Dr. Manish. What happened when pus cells is increasing, numerous above 50 after medicine, then the medicine change of increased potential? So very perfect question. मैं आपको बताना चाहता हूँ डॉक्टर मनीष कि होता क्या है कि जब भी कभी हमारी मेडिसिन जो है वो एक्ट करती है किसी भी पैथोलॉजिकल बेस पे, तो उस पैथोलॉजी को हटाने के लिए हमारी बॉडी की अपनी एक, जिसको हम लोग वाइटल फोर्स बोलते हैं ना, ये अपने आप एक एक्ट करना शुरू करती है। और हो सकता है कि पस सेल्स क्या है, पस सेल्स एक डेड WBCs हैं। तो जो डेड WBCs हैं वो जब भी डेड हो रही हैं, जब या तो वो उसके लिए बहुत ज़्यादा लड़ाई कर रही हैं या कोई बाहर से पैथोलॉजी आकर के उसको ज़्यादा किल कर रही है। अगर बाहर से कोई पैथोलॉजी आकर के हमारी WBCs को किल कर रही है तो इसका मतलब डिजीज इज इंक्रीजिंग। और अगर हमारी पैथोलॉजी ठीक कर रही है, हमारी जो फिजियोलॉजिकल पस सेल्स है वो थोड़े टाइम के लिए इंक्रीज होकर के उसको सिम्टम्स को ठीक कर रही है। मतलब जैसे आपके पास एक केस आता है जिसकी जो TLC हैं वो लगभग 20,000 है और आपके मेडिसिन देने के बाद वो 22,000 हो गई, लेकिन पेशेंट इज फीलिंग वेरी गुड, पेशेंट की जो फीवर है वो उतर गया है, पेशेंट की वीकनेस कम हो रही है, देन द केस इज गोइंग इन ए परफेक्ट मैनर। तो आप उसकी हर वीक आप एक बार TLC को रिपीट कराएंगे। लेकिन अगर आपको ऐसा लगता है कि जो TLC हैं वो भी इंक्रीज हो गई हैं, उसके जो सिम्टम्स हैं वो भी वर्स हो गए हैं, तो इट इज गोइंग इन द रॉन्ग डायरेक्शन। तो हमें पैथोलॉजी और फिजियोलॉजी एक्चुअली ये सिखाती है कि हमें केस कहाँ से लेना है, हम केस पे कहाँ पर खड़े हैं, वो कहाँ से आया है और कहाँ जाएगा। मतलब मैं अपने हर एक स्टूडेंट को पैथोलॉजी के बारे में एक ही बात बताता हूँ कि इस समय पैथोलॉजी कहाँ है ये पकड़ो, वो कहाँ से आई है ये पकड़ो, और वो कहाँ जाएगी ये पकड़ो। अगर आपको ये पता लग गया 3 स्टेप कि वो कहाँ जाएगी और कहाँ से आई है और इस समय कहाँ खड़ी है, तो 100% आपको रिजल्ट मिलेंगे। आपको ये एश्योर हो जाओगे कि मैं इस केस को ठीक कर पाऊंगा, मैं इस केस को ठीक नहीं कर पाऊंगा। ऐसे बहुत सारे लोग हैं। What we are learning in our OPD that in today's scenario we are not giving the dose orally right now, we are just applying the dilution. So homeopathy has so much power that we are just curing the patient just from the application. We are taking the pulse in her right or left hand, means कि अभी यहाँ पे जितने भी लोग बैठे हैं, जो लोग मुझे सुन रहे हैं, वो जरा अपनी अपनी पल्स चेक करें कि उसकी राइट हैंड की पल्स ज़्यादा चल रही है, लेफ्ट हैंड की पल्स ज़्यादा चल रही है। आप पाओगे कि ये दोनों पल्स जो हैं वो डिफरेंट होंगी और अपनी तरह से एक डिफरेंट काम करेंगे। हो सकता है 1 घंटे बाद ये दोबारा से बदल जाएंगे, हो सकता है उसके अगले 1 घंटे बाद दोनों एक से हो जाए। तो इस पैथोलॉजी को हम, इस फिजियोलॉजी को हमें समझना है। हम लोग हमेशा जो भी काम करते हैं बिना एग्जामिनेशन के या बिना किसी भी पल्स के एग्जामिनेशन के हम लोग कोई भी केस नहीं लेते, चाहे कितनी भी मेंटल स्ट्रॉन्ग हिस्ट्री मिल रही हो, चाहे कितनी भी फिजिकल स्ट्रॉन्ग हिस्ट्री मिल रही हो, लेकिन जब तक बॉडी की फिजियोलॉजी को नहीं समझोगे, जब तक आप किसी भी केस को क्योर की तरफ नहीं ले जा पाओगे। दैट इज फ्रॉम माय साइड। हाँ बिल्कुल, पेशेंट तो बड़ी हो गई ना, आपने उनकी TLC बढ़ाई है तो वो तो बड़ी हो गई, लेकिन आपको ये भी समझाना है कि नंबर 1 तो गूगल की नॉलेज लेकर के डॉक्टर के पास ना आए। दूसरी बात कि उसके जो सिम्टम्स है वो ठीक है ना, और आप, ये उसका राइट है। अगर आप उसको लगता है कि आप हमारे पास वो ठीक नहीं हो रहा है तो आप उसको भेज सकते हो, कोई बात नहीं, आप उसको समझा सकते हो, लेकिन ये पेशेंट का राइट है आपसे लड़ने का, आपसे सवाल पूछने का। तो आपको हर चीज़ का जवाब देना पड़ेगा कि क्यों TLC बढ़ गई, क्यों पैथोलॉजी कहाँ पहुँच रही है। तो आपको ये सब कुछ एक्सप्लेन करना। अगर वो नहीं सुनना चाहता तो मैं कह देता हूँ, मतलब आप जहाँ भी यूज़ कर सकते हो, तो जो भी पद्धति यूज़ करना चाहो कर सकते हो, कोई दिक्कत नहीं। हमें पेशेंट को एक्सप्लेन तो करना ही पड़ेगा। और जो ये पेशेंट वरी करता है वो भी तो अपने आप में एक होम्योपैथी के लिए सिम्टम है, इसकी भी एक मेडिसिन है। होप यू अंडरस्टैंड डॉक्टर मनीष। मुझे लगता है कि जो जो भी हमारे स्टूडेंट्स हैं डॉक्टर शिल्पी, ये शेयरिंग होनी चाहिए, क्योंकि जो क्लासेस हैं, जो हम लोग मेडिकल डॉक्टर्स हैं, ये शेयरिंग बेस पे हम लोगों को काम करना चाहिए। जो भी अगर कोई शेयर करना चाहिए, या लगता है कि हमारे जो भी अभी कोर्सेज हुए हैं, जिसने जो भी पढ़ाया है उसमें से किसी को कुछ लगता है कि नहीं ऐसा नहीं ऐसा होना चाहिए, तो जरूर हमें बताएं। हालांकि हम इस बात को हम मंडे को भी पूछेंगे। कल हमारी एक लाइव क्लासेस है, जो कोई भी अगर मेरी ओपीडी में आना चाहता है तो मेरे साथ सीधे डायरेक्ट शो मतलब सीख सकता है एक दिन के लिए, और वरना हम उसकी कुछ वीडियो क्लिप आपको शेयर करेंगे।
So definitely we will be very happy if people share with us all their experiences. If you feel anything else should be added in this, and there are few cases which you have treated and there were some very good experiences and things which you would like to share with us, please feel free to share all your cases, all your knowledge. We are open to this. That's why that is the major purpose of having these live sessions, so that we all also can benefit. Everyone here is a doctor. So that's why everyone would be having some or the other knowledge. So please feel free to tell us and share your knowledge with us. Fine. Dr. Deepak, are you sharing?
Yes.
Okay, fine. So that was a thank you note from Dr. DeepakSharma. So there are few more cases, in fact, not few, many cases which he has treated very much successfully. But I know time doesn't permit us to do so. So we will be having few more discussion maybe on the last day of the session and the day in which he'll be showing his live cases. You can clear many more things with him and he can present some more cases over there. So now the next session will be on Monday. Friday, Saturday, Sunday, we don't have any sessions as of now. So please everyone join back on Monday. On Monday, we will be presenting some questionnaires. The management part, which will be done by Dr. Sakshi, and few more things which Dr. Deepak would like to tell. And questionnaire will be there based on whatever you all have understood. And we have been trying to, whether we were trying to explain that to that extent, we will be getting to know that. And a few price distribution based on your ranking in the quiz. So don't miss the Monday session. Yes, wishing everyone a great weekend ahead. See you all on Monday. I hope everyone liked the session.
Thank you, Dr. Shilpi.
Yeah, thank you.
Thank you, everyone.